Hi everyone, this is Neel Raithatha, also known as the Wax Whisperer. Thank you for joining me in my latest video. We have here a patient who attended with a blocked right ear, and the wax is very dark, which tells us it's been there for a while, so it's aged, it's matured, it's oxidized. It's matted with hairs, which would also suggest the patient may be poking inside their ears. And once I remove this dark wax, and also it's a lot of dead skin keratin in the mix here, you will see that this patient has got an extremely retracted posterior, so the back part of their eardrum. And the eardrum is so severely retracted posteriorly that it's draped around the long process of the incus. So behind the eardrum in the middle ear, we have three bones. They're collectively known as the ossicles. The first bone is more commonly known as the hammer bone, but the medical term is the malleus. And that's attached to the anvil, and the medical term for the anvil is the incus. And the incus is finally attached to the stirrup, which is medically known as the stapes. And the stapes bone is connected to the organ of hearing, the cochlea, via a part of the organ of hearing called the oval window. And when sounds hit the eardrum, the vibrations that it creates are transmitted and transferred through the three bones. So these bones then move in synchrony with one another. They sway backwards and forwards like a pendulum almost. And as they do that, the stapes bone, so the stirrup bone that's attached to the organ of hearing, that moves in and out of the oval window, and which then causes fluid within the organ of hearing to travel in waves. And these waves travel over microscopic hair cells. They're called outer hair cells, causing the hair cells to shear forwards and backwards. And when these hair cells shear backwards and forwards, they produce an action potential, so some electricity. And this initiates nerves from the ear to the brain to be activated, and they send signals to the brain, and the brain finally processes these electrical signals as sounds. So the bones in the middle ear are very important in this within the hearing pathway. Now, the middle ear should be full of air, and the air pressure behind the eardrum should be equivalent to the air pressure in the atmosphere, so in the ear canal. When the air pressure is equal either side of the eardrum, that's when our eardrum is most mobile, that's when we hear the best, that's when the eardrum vibrates most in response to sound waves that are hitting it. So to ensure the air pressure behind the eardrum is equal to the air pressure in the atmosphere, there's a tube in the middle ear called the eustachian tube that connects to the back of the nose, the nasopharynx. And the eustachian tube is responsible not only to equalize the air pressure, but it's also a drain pipe, so any fluid that accumulates behind the eardrum can drain away. Now, at normal resting state, the eustachian tube, where it connects to the back of the nose, is actually shut. And it's shut for a reason. It prevents us from hearing our own sounds. If the eustachian tube is always open, when we talk and when we chew, these sounds will travel up through the eustachian tube and vibrate against the inside of the eardrum, and we can hear that. But it's also shut by design to prevent upper respiratory tract infections travelling up the eustachian tube and then causing an infection behind the eardrum in the middle ear. So the eustachian tube only opens, and it's completely involuntary action, during brief moments of chewing, yawning, sometimes talking possibly, and yawning. So chewing, yawning, I think there's one other, my mind's gone completely blank, but during these brief moments, the eustachian tube opens. There's muscles either side of the eustachian tube, they contract, and when they do, it causes the eustachian tube to momentarily open at the back of the nose, and that's when air can either enter or exit the middle ear to equalize itself against the air pressure in the atmosphere. And you've just seen there, we just peel some skin off the back part of the eardrum, and you can see the retraction, and that's the long process of the incus. The long process of the incus looks slightly deformed. So when the eardrum is sucked in, and I'm going to come back to that. So when so the eustachian tube, we've discussed the functionality of that. Now, if the eustachian tube doesn't open when it should, it means that air can't travel up the eustachian tube to equalize the air pressure. And all the remaining air in the middle ear gets absorbed by the cells that line the skin in the middle ear, till eventually there's no more air available in the middle ear. And at that point, there's a vacuum effect that's created, similar to when you fly on an aircraft and you're descending on the airplane, the eardrum gets pushed in or it gets sucked in. And when the eardrum gets sucked in as a result, think about the eardrum like a piece of cling film. It wraps itself around the bones in the middle ear, and in particular with the incus, the middle of the three bones, if it wraps itself around that, it starves the incus of all the blood supply and nutrients it receives via the blood vessels and capillaries. So the eardrum, when it's sucked in, it constricts, it squashes against the blood vessels, so it reduces the blood flow, and we can get a bit of necrosis of the bone. The bone begins to decay as a result because it's not receiving the nutrients, the blood flow that it requires. Sometimes also the ossicles can start decaying if there's an active infection in the middle ear. There's bacteria there, there's fluid build-up, and that fluid's infected, so glue ear, for example. But in this particular patient, they rarely suffer from an infection in the middle ear. It's just the eardrum is always sucked in. So that the long process of the incus was slightly deformed as a result. You'll compare it to this patient's left ear. This ear is absolutely fine. There's no retraction. The incus, it's not as visible as a result because the eardrum isn't sucked in. But this is completely as it should be, and it's a good comparison compared to their right ear. So just peeling some skin off here. It's really dry and crusted. There's a few hairs matted. Just a little bit left at the base. Let's just get rid of that. So I'm just using the fine end, just gently peeling it away, but mainly here on the cartilaginous portion of the ear canal. So we can afford to apply a bit of pressure on the ear canal without causing any pain or trauma to the patient. If we're on the bony parts of the inner 2/3 of the ear canal, we're going to be very, very careful because it can be uncomfortable for the patient. Because of these hairs, they can mat against the dead skin and wax, making it a bit more tricky to remove. It's just this last bit here. Anything else is fine. It's not going to cause any issues whatsoever. So I'm just tugging away at this backwards and forwards, just trying to separate it from the hairs. And I'm pleased with that. And then we're going to see the eardrum, which just looks absolutely textbook, that does. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.